everybody. Welcome to our stress relief boot camp. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And it has been almost a week since we've done a live video, and I did that semi-intentionally. So I want to see how you are doing, what you have missed, what you have been implementing on your own, if anything. And very quickly tonight, we are going to talk about physical stress. So about a week ago, we talked about chemical stress. We kicked off our, I don't want to call this stress relief challenge. It was our snack challenge. The response was amazing. If you saw the pictures, if you've been scrolling, the participation was incredible. So we're talking tonight about physical stress. Obviously, if you're in Chicagoland, it's finally been nice. You know, we've had a little bit of rain this week. But, you know, the limitations on quarantine have been lifted considerably, and a lot of people are getting out, they're being active, golf is open, there's lots of opportunities to become more active, the weather is cooperating. So I wanted to give you a little bit of a warning because the numbers in our office are going through the roof. I'm seeing injuries like no other. And we talked at the beginning of quarantine a little bit about inactivity and the stress that that can have on the body. So I want to talk tonight about changing your activity or implementing considerable activity too soon and the impact that that will have. So my few recommendations, of course, you know that I'm a big proponent of being active, of incorporating activity into your daily life. I got a Peloton during these last few months so that I can be active at home because obviously the gyms are closed. So if you are itching to get out and do something, my caveat is please be careful. So I want to give you a few recommendations as far as what warm up and cool down should look like. Please do not do static stretching as your warm up. So if you are going to go out and golf, if you are going to go for a run, if you are blessed enough to have the opportunity to do baseball or any of those sorts of activities, warm up should be active motion. So you should be doing rotational activities, you should be doing swinging activities that are going to warm up those joints. If you're going to hop in and start weightlifting, then maybe do the Stairmaster for 5 or 10 minutes. If do the bike for 5 or 10 minutes as a warm-up, get your heart ready, get blood pumping and circulating through those muscles. Do active movement. Do marching in place. If you're going to go for a run, go marching. Please do not stand and do a static quad stretch and then expect to run and call on those quads to activate. That's not how muscles work. We do not want to stretch them and lengthen them prior to calling on them to contract and do activity. That's the opposite of what we want. So I want you to make sure that you're doing active motion to warm up. And then when you're done, when you have completed your activity, that's when you want to do your static stretching. So that's when you want to do something like this and you want to hold it for a period of time. That's when you want to do, you know, something like this. Stretch out those muscles. You can even do that if you're sitting at your computer all day. You want to do that quad stretching, anything that you're going to hold, you know, do those hamstring stretches, hold that for 30 seconds. You want to do that at the conclusion of your activity, when your muscles are warm, when they're ready to be lengthened and they're ready to stretch. That's when you want to do static stretching. So if you have questions, of course, if you have an injury, please don't hesitate to reach out to us. Please get it addressed sooner rather than later. And if you have been inactive these last few months, that's okay. If you have been motivated by all of the videos that I've done on working out and on getting active, and you want to hop in there and you want to start doing something right away, you know, you're watching videos online, you're ready to go, you know, maybe it's warming up and you're having to wear less clothing and you feel like you need to be working out, you need to lose that like COVID-15 that some people are hanging on to now. Again, just please take baby steps, warm up appropriately, do activity based on your current level, not based on where you were in February before lockdown, not based on where you think you should be, or maybe where you were in the fall, you know, the last time you golfed. Please take it easy. baby steps to get in. I promise you'll be able to get right back to where you were prior to all this. Of course, if you have questions, please reach out, follow us. We have an awesome newsletter that we are trying to modify what we send to everybody. So if you get notifications from us, sign up to what you want to hear about. If you want to hear about vitamins, awesome. If you want to hear about physical therapy and stretching and foam rolling, sign up for that. If you want to hear about chiropractic and pediatrics and prenatal care, if you're having fertility issues, we're gonna really streamline, how we're communicating to everybody. That's at least what I've learned these last 90 days. I want to make sure that you are learning about what you want to know. Obviously, because you're in our stress boot camp, we're gonna be learning about stress. So stay tuned for some really awesome news. I hope that you have a wonderful evening. Get some rest. Busy week ahead, and we'll talk to you soon. Bye-bye.